Microwave ablation of thyroid nodules step by step. Indication benign nodules, and the equipment used echo microwave, and the position you sit a dental chair back of the head, and you can easily ergonomics, simply you can do it, and it's comfortable, and left side machine, right side ultrasound. And the anatomy, you should know the where you give local anesthesia, pretracheal fascia important. For local anesthesia, you give strap muzzle and false capsule, 10 ml, 2%, and you can add the sedations required. And the technique you give, you use a 100 centimeter extensor, and a assistant pushing the local anesthesia. You can just give away with a 23 spinal needle, 23 or 22 spinal needle you can use between the strap muzzle and a capsule, perithyroid local anesthesia. The beauty is, for you, local anesthesia is a daycare, and you can intermittent, you can check the larynx vocal cords by ultrasound. Coming to the hydrodissection technique, the hydrodissection use the colloid protecting lateral other structure, especially recurrent laryngeal nerve and the vagus and the middle sympathetic ganglion. So you installation of the a colloid solution in between the pretracheal fascia above this middle side and medial side of posterior and anterolateral. So at least 30 to 40 ml of colloid solution to given for protecting the peripheral structures, especially nerves. And you should maintain a buffer zone of above 5 mm thickness of the fluid, or we call it's a buffer zone 5 mm at least. So it is repeatable, you can do again. So you should know the hydrodissection is an important key role of doing this procedure. Coming to the ablation technique, we follow trans-ischemic approach, moving shot technique, layer by layer to point. So this is a 17 gauge antenna, and it is entering the posterior inferior border first, coming from posterior inferior border, and I am firing. Once I tip, without seeing the tip, you should not ablate. I am seeing the tip, now I am ablating. You see the white gasification. When firing is going on, you can observe the white gasification due to the microwave act on the cells having a water molecule. It disrupts the frictions, the hot water molecule, and causes the frictional heat and cell death. This is called coagulative necrosis. The temperature here, heating temperature is only below 85 centigrade, and a moving shot technique because of to avoid carbonization. So carbonization, why means carbonization, it cannot heat this carbonization tissue more than 100 centigrade, so it cannot phagocytosis. It will cause the infection, cause the pain. So moving shot technique we follow because of coagulative necrosis. And the inclination, the probe in the right hand, left hand, the antenna you have to inclination you do where you are going, lower border or medial border or lateral border and superior border or medial border. So you know how the 3D structure of the nodule. So you have to clear all the layer, all the slides, all the layer, all the border of the nodule you have to fire. You 360 degrees you have to ablate it. It's not the one side. So for this reason we are using a new technique called zigzag moving shot technique. Zigzag means it's like a lower from coming to the one ablation zone, then another ablation zone, another ablation layer by layer, and it's a border by border. So this manner we are using a moving shot technique with a zigzag manner. This will have a sawtooth appearance in the border margin. Sometimes we also use a toxic nodule, we use the artery first and the margin. So to avoid recurrence, we also use the margins of the nodule, a vein ablation. So we follow this advanced technique, vein straining technique. You see the nodule in the margin also we are ablating. We are coming to close to the nodule margin. So this is the technique we follow to have a this moving shots and zigzag maneuver and the total ablation of the nodule. Okay. So while doing nodule, intermittently you can check the ultrasound with the larynx vocal cords, the status of recurrent laryngeal nerve. See the recurrent laryngeal nerve, if it is anything like it's not vocal cords not moving, then you go for rescue for recurrent laryngeal nerve. You can use a D5 solution with a freeze D5 solution. You can pour in tracheoesophageal groove. You can protect the recurrent laryngeal. That is the beauty of local anesthesia. That is the importance of local anesthesia. So, and the technique I told already. So you after this you do all the ultrasound, then see the any residual. You have to do what you do residual. Again you go for contrast, or you can use for a color Doppler. So to effective technique to monitor by the contrast or Doppler. You do a Doppler, we have done a Doppler, there is a residual in the superior border. So we are giving one more shot. This is called a supplementary shot, supplementary ablation, and this is. So we have to compare this radio frequency microwave. Microwave is a better energy, super energy. It's a smooth firing energy, no required pads and no heat sink effect and no tissue impedance, and it is repeatable, and a tissue coagulant is very superior than the radio frequency. Radio frequency just alternate current. Just we prefer always microwave for a solid cystic nodule of thyroid. So the beauty of thyroid nodule here is we are saving the thyroid gland here, and we are protecting the thyroid gland now. So and it will shrink us after 6 months. Thank you.